Hello, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about a injectable peptide called BPC-157. And BPC stands for Body Protection Compound, and it is a sequence of amino acids. And let me see, there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 amino acid sequences, or 15 amino acids that make the BPC peptide. Its molecular weight is 1,419, and its real name is called gastric pentadecapeptide. So you can imagine what it's used for. It's used for gut healing, wound healing, general body healing, promotes tissue and wound healing in skin, muscle, bone, and ligaments and tendons. It increases stem cell production, so that's great. And it has gastric protection for ulcers and irritable bowel disease. It improves the GI mucosa barrier, so it's used in leaky gut, and it decreases the effects of NSAID and ETOH on gastric mucosa. It improves burn healing rate, it's an antioxidant, and it has neuro and cardioprotective traits. It can be an adjunct for cancer cachexia, wasting from cancer treatment. And the general dose for sub-Q, it's administered sub-Q, is 300 to 600 micrograms a day. And basically, you do 5 days on, 2 days off, and that way you don't build up a resistance to it. And you use an insulin needle, so it doesn't hurt, and you just give it right in your abdominal fat. And it really helps promote healing, and you should see changes within 2 to 4 weeks of beginning the treatment. Everybody's different. Generally, we start low. We start at like 5 units for 2 weeks, then 10 units for 2 weeks, then 15 units for 2 weeks. And then some people can tolerate 20 units. It just depends on the individual. It is derived from gastric juices. So, obviously it's really healing for the gut. So I've been using it a lot, basically for wound healing and gut support. So I think that it's a benefit for all patients that are on antibiotics, because antibiotics rip up the gut, no question about it. But what's the alternative? I mean, you can't not do antibiotics. You have to do it. So it's called BPC-157, and it's an injectable peptide right into the abdomen. You do it 5 days on, 2 days off, and it should be really helpful for wound healing and gut healing. So I hope this information has helped you, and I hope you have a wonderful day. Take care.